I recently had the opportunity to speak with Dan Nightingale, Clinical Team Manager of Drury Lane Physiotherapy, about his experience with the Physician Engagement Festival. Drury Lane was part of the PEF pilot and is now one of the more than 60 clinics involved in the PEF program. Dan has been able to build great relationships with physicians and receptionists alike, and it shows in the amount of referrals the clinic is getting. I decided to ask him about his experience and to see if he had any tips to pass along to the other clinics involved in the program. What kind of patients do you typically see at Drury?
It's a mix of musculoskeletal conditions. We see workers' compensation patients, motor vehicle accidents. We just received OHIP designation here, so we're seeing some of the older population and younger population.
So you were in the PEF pilot at Drury. You're one of the clinics who chose to join. What results did you see from that pilot?
The big thing was we were probably getting a lot more referrals from some of the doctors that were referring before, but not as regularly.
I know you were one of the clinics that were really great with consistency and definitely doing more than one visit a week. So how often did you typically go?
We had probably about maybe 6 to 8 doctors that were given to us that I was supposed to visit, and I tried to do maybe 1 to 2 visits a week.
What works best when you're trying to set up a visit with a physician? Do you kind of keep it casual? Do you arrange a visit? How does that usually work?
So upstairs here we have the surgeons, so I already have a pretty good relationship with the surgeons and also their receptionists, so I can just go up there anytime I want and really talk to the receptionist, hand off reports, or just hang out and wait for the doctor to come outside. Maybe he's in between patients and I can have a quick word with him. It also depends on the type of doctor's office I find. So there's a couple family doctors that I went to go visit, and it was sort of that small practice, like just one doctor, and those were a lot easier I found to meet the doctors, so it wasn't as busy. I can talk to the receptionist, get to know them, maybe have a little bit of small talk with them. I even found sometimes going sort of when the clinic was dying down, maybe after hours a little bit, when the receptionist was just there, I was able to talk with the receptionist a little bit, build a little bit of rapport with her. When there was a busier clinic, sort of when there's like a family health team and it's a really busy practice, I found that the best bet was just to go and try to introduce myself, drop off some reports or give the reason why I'm going, and explain that, I'm a physiotherapist in the area and this doctor refers to our clinic, but I've never actually met them, just wanted to try to meet the doctor in the area. And some of them will tell me maybe a time I can come back and chat with them, or some of them actually will allow for, I think they call some of them called rep meetings.
Yeah.
And you can set up a time actually to go and chat with them, and they'll even tell you, hey, if you bring coffee, and they'll maybe say, like, one of the doctors told me he likes a Starbucks Frappuccino. So I went and got a Frappuccino for him, and I had set up a meeting. It was for early in the morning, and we were able to talk a little bit.
So how important do you find it is building a relationship with a receptionist?
The receptionist is definitely the gatekeeper for the doctors, so if you can get to know the receptionist, there's a good chance you can probably get a meeting with the doctor. Or also, I find a lot of the times it's the doctor maybe will recommend physiotherapy, and the receptionist might be the one that says, hey, I know Drury Lane Physiotherapy is the place to go, and it might even be the receptionist that's the one that's referring the patient to you.
Have you ever had a negative experience with a physician where they were sort of rude or didn't have time, or something that was a bit discouraging when you were trying to meet with them?
There was one time where I was trying to meet with a family doctor in the area. I actually set up a meeting with them, and then the next day I think I got a phone call from the receptionist that the family doctor actually canceled the meeting. So you just got to get a feeling of, is it going to be a possibility to meet the doctor? And if you keep going, I still go and drop off reports to this doctor, and just so she has an idea that I am treating some of her patients.
Now that you've done the pilot, how do you feel that the actual full-bore PEF program is working for Drury? What are you noticing?
We're seeing with the new referral pads with our pictures on them coming in a bit more often. There's been some doctors that referred a little bit to the clinic, but not as often in the past, but now we're seeing more of their patients coming in. And then I always ask the patient in the assessment, how'd you hear about the clinic? And they'll usually say, oh yeah, my family doctor said specifically to come here. So building that personal relationship with that doctor, getting that rapport with them, it makes them more comfortable actually referring to a specific clinic, I think. So they don't mind saying, hey, go straight to Drury Lane, Dan will take care of you.
What have you learned along the way? Do you have any tips or tricks that you'd like to pass on to the other participants in the program?
It's sometimes a good idea to say to the patient, hey, let your family doctor know how well we're doing, and if they give that feedback to their family doctor, that gets messaged up, and then they feel much more comfortable referring more patients here because they know the patient experience is greater than maybe another clinic that they've heard of in the area.